Hello, this is Dr. Arti Kandolkar. I am a consultant psychologist and a counselor. Today, we are going to discuss on anxiety disorders, like what is anxiety disorder, what are the different forms of anxiety. You can also say there are different types of anxiety disorders. So we are going to cover types as well. Okay, some symptoms which are psychological, emotional, or you can say even physical. So this is what our entire topic is for today. Okay, so let's begin with understanding what is anxiety disorder, types and symptoms. So let's begin. So we'll study initially what is anxiety and an introduction to it and types. Next, we have seen the types, right? We'll be discussing about this, but now we'll see the definition of anxiety. Now there are a variety of definitions available on different sites and different books. Okay, so we have just picked up one among them, and this generally goes with the APA, that is American Psychological Association. So it says anxiety is an emotion. Okay, so it's an emotion characterized by feeling of tension. So feeling is also there. Worried thoughts, so thought is also covered, and physical changes like increased blood pressure. So what is anxiety? So anxiety covers almost every part, and you can say every structure of human being, that is emotions, feelings, thoughts, and you can say physical changes also. So it is affecting our entire physique, okay, internally and externally as well. So next, after seeing the types and the definition, let's move on to the introduction of anxiety disorder. Now, what is there in an introduction? So introduction will cover some points which will focus on anxiety and related concepts like fear. Okay, so let's begin. It says anxiety is a commonest psychiatric symptom. Okay, so that means it's a very common phenomena to occur in any human being. Okay, it's not something rare, like you can say schizophrenia, or you can say mood disorder. It's something rarely to occur in a human beings, but anxiety is the commonest in you can say in general population as well as in a psychiatric ward or a clinic. You'll find this patient in a number of cases. Very routinely you will get these cases. So it covers around 20%. Okay, around 20% people on an average will suffer from anxiety symptoms. Second, you can see they have said something about fear. Now it looks like fear and anxiety are similar, but there is a mild difference. We'll be discussing about this. Okay, so let's understand one more point about anxiety is fear is a response to external danger, means outside danger, while in anxiety, the danger is largely unknown. So what is the difference between anxiety and fear? Anxiety is something internal, which you feel, okay, which you experience internally, okay, that is uneasiness and all, while fear is something external. You know something is outside and it is fearful. Like suppose there is a snake over here, or there is a spider or something which I'm scared. So that is fear, not an anxiety. But suppose it is an, what you can say, you know something is going to happen. There is an exam after some days. So you will be like, it is in response to future events. Okay, response to some stressor outside us. Okay, so it is like that's, means anxiety is internal while fear is outside our body. We know there is exam approaching. So it is something stressor. We perceive exam as a stressor generally. So it's a reaction to that stressor. That is, you can say, fear. Okay, so next, the third point, if we cover here, is anxiety is a state of apprehension. Okay, anxiety is a state of apprehension or unease arising out of anticipation of danger. We just already discussed about this. Is an anticipation, means you are predicting, assuming this something is going to happen, and mostly it will be negative. If something is positive, we call it eustress. Okay, this is something like a distress, negative event. So it is like we assume and it becomes uneasy. Okay, anticipation of some danger. Danger could be anything, like you are participating in some maybe bungee jumping or anything, it could be danger. Okay, outside. It's generally outside. Okay. And then the fourth point is anxiety becomes pathological. This is a very important term. Okay. Which significantly subjective distress and impairment in the overall functioning of an individual. So what does this mean? That it is pathological means it is something dangerous. It is something very, you can say, psychotic in nature. So it becomes dangerous. Anxiety is there in almost every individual. Just like there are 7 emotions, like there is something like excitement, that is happiness, sadness. Okay. Similarly, anxiety is 1 out of 7. It's not something different. Everybody has it, but it is called pathological or it is called disorder only when there is significant means larger quantity, or which is very much visible, which is very much obvious. Okay. When it becomes significantly significant and it causes subjective means personal, distress means something negative. Okay. So personally you are stressed, personally you are distressed. And impairments, it is disabling, means it is making you disabled, or it is making you not work or function properly. So your functionality is affected. So it is called impairment in the overall functioning of an individual. Overall means what? Overall means your all the major areas. Like for example, maybe you're doing some job, you are a parent, you have to look after your kids. Maybe you are in some social gathering, you have been given some social responsibility. Okay, everywhere. Okay, or even if you are personal, like grooming, taking care, brushing, having bath, this is your personal care. So even this is affected by anxiety. So this is like what I was trying to cover, like what is anxiety? This is an introduction to anxiety. Okay, so hopefully this is understood. Causes of anxiety. So we are not going to look one anxiety and its causes. In general, we are going to cover it. The first causes of anxieties are anxiety developed from a complex set of risk factors, that is genetics. Genes are responsible for this. Okay, means you have got it from your parents, maybe your family members, so it's traveled down from your genes. The next is brain chemistry. When there are certain parts of the brain which may be affected due to an accident or maybe an infection, okay, or some other factors. Or maybe you are having some other disorder like schizophrenia and all, and it is affected, brain chemistry. Then personality and life events. So your personality is anxiety prone. You are from childhood, you have been raised, or your family has been anxiety, like experiencing anxiety, and you have got it as a social thing. Okay. And life event, maybe there was some stressful event, like you've been bullied in a childhood, or maybe you have experienced people in your family or in your school or neighborhood who are more anxious, and you have been doing it modeling. Okay, you have learned to be like that. Treatments. Okay, so generally when we talk about treatment, we can do therapies and everything, but the basic anxiety, if it doesn't go mild and severe, you have to give medicines. Okay, if it is not treatable, and then after giving medicines, the person is much in a relaxed mode, you can do therapies. Okay, the medicines is the first form of treatment, but the golden rule for anxiety treatment is medicines plus your therapies. Okay, so medicines most often used to treat anxieties, generally which are very severe and difficult to go. Okay, it is from childhood, now the person is grown as an adult with those anxieties, it was never been resolved. Okay, class of drugs known as benzodiazepine or minor tranquilizers. Because anxiety is too often associated with depressive disorder, they're like two sides of the same coin. Okay, it is essential to treat the underlying depression along with the anxiety disorder. Means, suppose you have been having anxieties over a period of time, and now it may so happen that you have feeling that I'm not able to overcome this, it is out of my hand. Again, doing everything, I tried everything and it is not working for me, you can drift into a little bit of a sadness, and this sadness over the period of time can lead you to depression. Now, if you have already got, along with anxiety, depression, you have to treat the both. You cannot just focus on anxiety. You have to look at the both the factors. When depression is healed, symptom of anxiety often diminish. Okay, so if you're treating depression, anxiety will automatically get little decreased or diminished. Okay. Some other thing is exercise and relaxation technique. Very common in a clinical practice. You will be having somebody giving you to do like homework to do exercises and relaxation. So deep breathing, meditation, okay, exercises like walking maybe, or doing cardio exercises. All this is recommended because it increases the serotonin level, which is responsible for anxiety. Okay. So regular exercises reduces skeletal muscle tension, mobilizes excess adrenaline and thyroxine in the bloodstream, chemical which keep the state of arousal normal. Okay. It discharges pent-up frustration and anger as well. Okay, if you do regular exercises. Next, because anxiety clearly has been physical component, especially when it manifests as a panic attack, technique for relaxation, relaxing the body are very much important. Like for example, muscle relaxation technique, okay, is very much essential. The next thing is deep breathing. Deep breathing is very, very much recommended. Before sleeping, you can try like inhaling, retaining and exhaling. Okay. These techniques very much helps people to at least temporarily relax. Okay. Progressive muscle relaxation technique. Okay. This is Jacobson's technique. Then, and biofeedback techniques. So getting feedback from your own body reactions. Okay. And combination of medicines, therapy and relaxation is the best possible thing to treat anxiety disorders. Okay. The next one is cognitive behavioral therapy. The next technique to handle anxiety is CBT. Okay, we generally say CBT. So cognitive behavioral therapy, as you know, cognition means thoughts. Okay, thoughts. And behavioral means behavior. Behavior. So thoughts and behaviors we try to modify, means whatever, not those who are healthy, generally which thoughts are unhealthy, which are more negative inside, and even your behaviors is impacted because of your negative thoughts, are tried to change in a cognitive behavioral therapy. So what happened in cognitive is a psychotherapy that helps you to alter anxious self-talk. Suppose if you are saying, I am always a failure, I am so dumb. Okay, this is a negative self-talk. This has been changed, means in a CBT, we try to change your sentences also. It's like, I'm always a failure. It's a, sometime I do make a mistake and it's not something very severe. Okay, it's okay to make mistakes. Or it is like, so this self-talk are change your sentences, your conversation, which are more negative. Okay, or suppose I had a presentation and screwed it up, or I couldn't make a better presentation, I am just a loser. Rather than that, the therapist will help you to frame a sentence. It's okay to slip up sometime. It's okay to make mistake. Okay, I am not the perfectionist. Otherwise, I have done so many useful work in my career, and this is just one of them which I couldn't make perfect. Okay, mistake and mistaken belief that give the body anxiety producing messages. So if you feel negative talk, it is going to produce negative messages in your brain. Okay. The next, overcoming negative self-talk involves creating a positive counter statement such as, I feel anxious and still drive, or I can handle it. So if you feel, I cannot drive, I'm too much anxious, okay, I have anxieties and I'll meet with an accident. These thoughts will be replaced by, I can feel anxious, it's fine. Okay, I can still drive and go to my destination, or I can handle it. Whatever happens, I'm fine with it. So this is a way you are taught to handle your anxieties. Irrational beliefs are, I'm powerless, I cannot do things, life is dangerous, it's not okay to show my feeling. This could be the thoughts maybe taught to you by someone or you have developed yourself. Can be replaced by belief with empowering the truth helps to heal the roots of the anxiety. Okay, like this can be changed. The life is not so dangerous. Events come and go. Things are sometimes very difficult to handle, but it's okay. Okay, I'm not all the time powerless. Sometimes I may feel powerless, and that too is fine. Okay, so this is how CBT can help you. There are various techniques of CBT. We will be discussing in our topic called CBT later on. Okay. Next treatment method is diet and nutrition. Okay. So yes, of course, along with your exercises, along with your medicines, along with your therapies, you require a good diet and nutrition to help relieve your anxieties. Okay. Monitoring your diet is very much important. Okay. Stimulants such as caffeine, nicotine can aggravate anxieties. This is according to the research, and leave one more prone to anxiety and panic attack. Okay. Second, sugar, certain food additives and food sensitivities can make some people feel anxious. So eating too much of sugar, okay, or additives can make people more prone to anxieties. Seeing a nutritionally oriented physician or therapist may help you to identify, eliminate possible offending substances from your diet. So you may be eating certain foods which may not be healthy for you and your anxieties. So if you make a dietitian, okay, to consult somebody, he may identify which foods you are consuming more, maybe having too much of an alcohol, cigarette smoking, drugs, maybe too much of caffeine and nicotine. So those things can be identified, can be modified, changed, and your means those anxiety provoking thoughts can be reduced. Okay, so now to wind up, we have seen all kind of anxiety types, forms of it, symptoms. Okay, how anxiety is different from panic attack, everything we have seen. Now to end up with the positive note, anxiety is treatable. Okay, try not to get in an anxiety spiral. Okay, you are always more than your anxiety. Okay, so believe this, you can overcome anxiety anytime. So consult your psychologist or a counselor and be on the constant vigilance with this. Thank you.